This is Breaking Stereotypes. I'm your host, Kristy Ramnarine. It's Menopause Awareness Month, and we continue our discussion about perimenopause and menopause. Joining me on set is everyone knows her as Dr. Monica Davis, and she's a board advisor to the Family Planning Association of Trinidad and Tobago. Welcome, Dr. Davis.
Thank you very much. It's a pleasure, and family planning is always happy when we are involved in spreading the good word.
Glad to hear. Now, we know each other because we literally see each other almost every week, I would say. And that's because you are also part of the diplomatic community.
Correct. I represent the Bahamas as Consul General in Trinidad and Tobago.
Okay.
With honor.
You were born and raised in the Bahamas?
I spent a lot of my time actually in the UK prior, but my heart is tied tightly to the Bahamas. I was there from an early age.
Okay. And, how long have you been residing in Trinidad and Tobago?
Probably as long as you've been alive. It's been several decades. It's an amazing story. So, you know, Trinidad and Tobago, I came initially because of my husband at the time. I never thought I would be here 44 years later.
Yeah.
I came as a little girl. I mean, I was like in my 20s when I came here.
Yeah.
So it's my adopted home.
Yeah. And since you've been here, you've always been involved in numerous organizations. You know, tell us a bit about yourself and what you have done in Trinidad.
You could probably say I've grown up in Trinidad from my adult life. I was very fortunate to be encouraged to join the medical. I was at the health center in Macoya. They had just opened it. They didn't have a physician at the time. Even though I wasn't a Trinidad and Tobago national, I was allowed to function there for 4 years until they actually found somebody local to take over. Okay. By that time, and this was a new health center, so it was amazing for me and had a lot of things. So by that time, I had made quite a few friends and contacts because I had no family here at all at the time. And shortly after that, my daughter was born 4 years after came here. And then I was after the health center, I came and was a volunteer for family planning. Again, blessings, because I'm not an OBGYN, but I did OBGYN in my career. And I'm happy to say that I've actually delivered at least half a dozen Trini children.
Oh, wow.
Here.
Okay.
And now they're like, you know, they'll come up to me and say, Dr. Davis, you delivered me. And I do. I did. And I said it was a pleasure. So that's a strong connection as well.
Yeah.
And during the time when I was working with family planning, that was just part-time volunteering. Thanks to Dr. Jean Wong, who I was the first person who was a non-OBGYN to work with them at the clinical sessions. They were very successful. Dr. Trona Bennett, now deceased, was my mentor for infertility. So all the infertility stuff that I know came from her. And I eventually ran the infertility clinic at Family Planning as well, which was my joy and pleasure to do.
Yeah.
And at the same time, I opened a part-time private practice in Trin City, which we carried on until about maybe 5 to 7 years before my retirement 4 years ago, because I wanted to sort of phase things out because I knew I'd have other stuff. But, you know, when we were talking about, most people know me as Monica, so my maiden initials are EMD. And it so happened divinely that my 3 careers that I've been practicing for the last 30, 40 years, E is for education, M is for medicine, and D is for diplomacy. And the I for my married name is like international, because I was born in one place, lived in other places, and now ended up here. So it's like, it was, I don't know what to call it, serendipitous that I ended up here in Trinidad and Tobago.
Yeah, and you know, you love Trinidad and Tobago.
I do. I mean, you always love your home country more, but I mean, I think I'm blessed. From the north to the south, the Bahamas in the north, Trinidad and Tobago in the south, and everything in between I have ties with, so it's great.
Now, you know, you're back with family planning. You were a director on the board for 9 years.
Yes, for 9 years. My term expired after 9 years, because you do it like, you know, every 3 years as a term. And I'm honored that they asked me to continue as a board advisor, because it's something that I've grown to love through volunteerism, and then through the opportunities I had to learn a lot about family planning and infertility. And because I was a practicing physician, pap smears and all those things are second nature to me. You know, dealing with these kinds of conversations where people are not quite sure what to call our body parts.
Yes.
That comes very easy to me to explain to clients and stuff. So I think it's a very synergistic and close relationship, and I'm happy that I've been so blessed.
And now, the new chapter, perimenopause and menopause, the announcement that family planning will be opening.
Well, we're actually open we have a clinic every Wednesday at the moment.
Okay.
It is something new. We've had a new upper management team, and we've been actually working very hard to get things to a point that we want them. Of course, you never get exactly what you want for a while, but we did a survey, a public survey, and on the basis of that survey, it was clear that people wanted and needed something surrounding menopause. And a lot of people think that menopause is a period of time, but menopause is actually the cessation of menstrual periods. So it's one point in time.
Yeah.
So we refer to it as perimenopause, prior to menopause, the menopause where it stops, and post-menopause.
Yeah.
So our clinic is dealing with all of those at the moment. So let me just get to the basics. We have 2 clinics, one in Port of Spain, on the corner of Oxford and Charlotte Streets, and I'll give you the phone number, 623-5169. Let me just make sure. Yes, I got it right. That's the one in Port of Spain. And then we have another one in Bertrand Street, 50 Bertrand Street in San Fernando, and that's 652-3065.
Okay.
And both clinics are open from Monday to Friday from 7 in the morning until, no, is it 7? Yes, I think it's 7 in the morning until 3 o'clock in the afternoon. Yeah, so we are there all day. People who are going to work early, they can come in and then go to work. People who come off shift, they can come in after shift, and we'll be there till 3. One notable, we do pap smears a lot. We do screening diagnostics to make sure whether there's any issues. We're working now on lots of exciting and innovative packages, which we want to make affordable to those who are underserved and perhaps can't. The perimenopausal clinic that we're operating now is only at Port of Spain for the moment, and we are very privileged to have Dr. Durga Lyons working with us as a qualified OBGYN and a lovely person, and she's very passionate about what you have to be passionate about this stuff, otherwise it's not going to work. And her clinics are on a Wednesday, again, evidence-based. That was the best day for most people to be able to come. And the clinic hours are from 9 o'clock in the morning until 1 o'clock in the afternoon.
Okay.
So people can come in and do their regular stuff if they wish. The thing is, in order to make this really quality, obviously we have to charge a fee, but the fee doesn't come to us. The fee is we are providing a service, so we pay the provider.
Yeah.
Sort of thing. And it is actually at this time a very affordable $425 for a consultation. You can't just come and see somebody and they prescribe. You have to see, the doctor has to see the person, take a history, get acquainted with the person, come to a sense of where they are, what they need, and when they will need it, how soon. If there's a need to do a pap smear there, we have those at nominal charges and so on. So it's really a perfect alliance at the moment. And what we are hoping for is that a lot of our subventions are specific to youth, as per the International Planned Parenthood Federation. But for us, Family Planning in Trinidad and Tobago, we would really like to expand, but we cannot use funds for other things
projects
other than the specific program grants that we get. So if we get some additional grants that are not tied, or subventions that are not tied
to specific
things, then we can actually start doing a service in San Fernando for the perimenopausal as well. And the more traction we get, the more we'll be able to facilitate those who are underserved.
Yeah.
And in some cases not served at all because they simply just can't get to where they are. But whoever is coming, and those who have come, they are saying that that's the best $425 they have spent.
Well, I was now going to ask you about that in terms of, since the clinic has opened, in terms of the perimenopause clinic in Port of Spain, what has the feedback been like?
The feedback has been, at last, we have something. This is wonderful. When are we going to do it in San Fernando?
So before we go into that, I want to hear more about that. I only learned about perimenopause late last year. I didn't know what perimenopause was before. Do people know what perimenopause is?
I'm hoping that more people know now,
Yeah.
and we want to strengthen our education programs and our follow-up so that we know that people are not only hearing about it, but they're learning about it, and they're acting on what they know to the betterment of themselves and their families.
Yeah.
So I used to do a lot of writing in the newspapers for menopause or little things for various organizations to which I belonged, because I was working in family planning at the time and so on. And of course, I went through menopause myself.
Yeah.
That point in time came where, hey, I'm no longer having periods, post-menopause. But a lot of people thought it was just, it was something that lasts a long time. But that's what we call the climacteric, that phase. And these days, for various reasons, some people go into menopause early. Some people, if they have malignancies, cancers, and they have to remove their uterus or their ovaries or both, sometimes it's necessary, they go into an immediate menopause, which is a shock to the system.
Yeah.
And so they have to use hormone replacement therapy. Other people who come up to menopause suffer. Some people just get fogginess. They get, of course, all the males around, they say the women get irritable. But then, you know, it does happen. The hot flashes, or they call them all kinds of different names. But there's a period of discomfort for a lot of people. It also reduces the libido, which is the desire to have sexual relations.
Yeah.
And that can be a huge problem, not only for the women, but for the men. And then that's another problem. So we're trying to promote good family planning, good relations, more than that, just to have people being happy. The happier you are, the healthier you are, the better, the more you thrive, the longer you live, the more you can contribute, and so on and so forth. So we're trying to demystify it now, so that people like you who just learned about it last year, learn about it now. And we are planning to do a series of discussions and workshops, and I'm really looking forward to these because I want to join some of them as well. In fact, we have our first one next week, Wednesday, which is October the 15th, at 12:15 in the day. Okay. I can always give you more information on it. And at that point in time, our executive director and deputy executive director are actually planning and working on that with our, I must tell you, family planning staff. They're so hardworking. Thank you, guys. And we're actually planning to have it streamed so that it can reach more homes and more people. So that even if you can't get to the clinic for the discussion, you can at least watch it. And hopefully we're going to be recording it so that we can actually play these discussions back in the clinic when they come for their services. We have a screen already, and we can just replay some of these things so that people will get a better idea and they can spread the word. Everybody knows somebody who's either going into menopause naturally, had surgery, or is already there and past and into postmenopausal period of their lives. You know, 400 years ago, when women stopped having periods, people didn't realize, and they thought women were witches. Women are supposed to bleed every month. If you stop bleeding every month and you're still alive, that means something is wrong with you. You're a witch. They got so much flack just because of lack of education. Yeah. And they were frowned upon and ostracized. And I think this may be part of the reason why it's still sort of a mystical thing, because people don't want to hark back to those days. But it's really not. It's a part of life. Yeah. And it's a part of life that those who know and are willing and caring enough, like our Family Planning Association of Trinidad and Tobago, to help with, it can be a breeze.
So let's go back to the feedback now.
Yes.
In terms of those who would have come in for the clinic, the Perimenopause Clinic.
They are very happy that we responded to their need, because they're saying, you know, we really needed this, we like this, we feel comfortable, we have a safe space to go to learn things and to get stuff done. And I mean, if there are other questions or other things, we can act as a referral center to help them. For example, we don't have, at the moment, we don't have blood testing, and that's one thing they would like to have some, because people hear about you can test to see whether you're in menopause or not, and they want to know. Yeah. At the moment, we're not able to do that, but we are working on it, and we have plans afoot to deal with a medical laboratory and have somebody take the blood, a phlebotomist, and be able to get that done. So they're saying, first of all, they're very happy that we responded to their need. They're happy that we responded to the times that we'd like to have it, and having it on a Wednesday in the middle of the day, so people can come during the lunch hour as well. Or those who are going to work in the afternoon shift can come in the morning, and vice versa. They're also pleased that it's centrally located in terms of being in Port of Spain, and they don't have to go to another space, and also in San Fernando. We just opened a new actual space in San Fernando earlier this year, maybe about 6 months ago.
Okay.
And so they have that, and it is accessible.
Yeah.
And so they're happy for that. I think I have not heard any negative feedback, at least not yet. And I don't think there should be any, because we are making strides to make it as accessible and as useful as possible.
What about hormonal replacement therapy? Does the clinic offer this?
No. In a word, at this time, no. There are many reasons for that. Not to mention the fact that it's quite expensive. We are trying at the moment, if when our clinic doctor determines that yes, this is a good candidate for HRT, as it's often called, then we would be able to refer to people to either access the blood test that would let them know whether they need it or not, and sort of align with the diagnosis, or where to get it, and if they have the means, they can do so. The thing is, it's not hormone replacement therapy has saved so many lives, so many marriages, so many women's health issues. It's cured depression. It's not, of course, it's not a cure for depression, but once you have the hormone replacement therapy and you feel better, so you're no longer depressed.
Yeah.
But it's not something that
You're
can
no longer
just be
cranky.
It's not something that we can just say, here, take this, because there are and there can be contraindications to taking HRT, and we firmly believe that we need to use evidence-based medicine to determine who needs and who is best served, and those who should avoid it altogether.
Yeah.
Because there is an association with negative effects from HRT, although a lot of this now has been demystified as well, and we have some excellent specialists in menopause therapy and management and treatment. So we will, while we cannot do it, we will be able to refer, and hopefully as we enlarge our space in that regard, we will be able to have a means to prescribe it or disseminate it where necessary. But the advice is that basically it shouldn't be just over the counter. You shouldn't just go and get it, because there are some side effects.
Should be prescribed.
Prescribed, so that you know that you're taking it because you need it. Again, evidence-based.
Yeah. Where do you see, this perimenopause clinic going in the next, I would say, 5 years? As more and more women find out about perimenopause, we've always heard about menopause. I mean, it has always been there. Yeah. But now you're hearing about perimenopause. And the fact that you do have, you start the transition during that period, and you do have symptoms of menopause.
You can.
Yeah.
The typical age for menopause in Trinidad and Tobago is 47 to 51 years in women, but people can go as early as 40 and sometimes even before, and some people can go later.
Yeah.
So that is one thing that's good. In 5 years, all things being equal, and all things being equal means if we are fortunate enough to procure additional grants, what we would like is to have grants dedicated to the Perimenopause Clinic. So that way we can give a real quality package, not only the consultation that we have now, not only the pap smear and so on, but in-depth consultation or a series of educational talks by menopausal specialists who exist. And we have some, as I say, and because of the technology, we can do this by Zoom. They can come and have a powwow at our clinic. And we have another area that people who are looking after elderly people, or people who have menopause, we have something called the living room, where it's a more informal setting, and we can do like a movie night there and show things about that, and they can carry that information home to their elder loved ones. Or if they notice, hey, my mother looked like she getting things, let me see if I could get some information. So we're trying to help from whichever angle we can. And I see it being very successful, but I also see very practically that we need to have support.
Okay. Does family planning work with the Ministry of Health when you're doing new projects?
We actually get a subvention from the Ministry of Health, which we are very grateful for. Collaborative efforts are underway. In fact, we have initiated talks with our new minister, and he is very willing to listen to what we have to say. And in fact, very shortly, we have a meeting planned, and I'm very fortunate that I knew Minister before, and I also know the other minister in the ministry, who is one of my former students, I'm very proud to say. And I think they because they're both in the profession as well, they understand the need and they value what we have to say. So I can't guarantee anything, obviously, because there's only a certain amount of money to run things. But I'm certainly, we at Family Planning are certainly going to see what we can do on a most cost-effective level with some synergy to help as many people as we can.
Okay, now let's talk about family planning itself in terms of it's an NGO. Am I correct?
The association, yes, it is not for profit.
Yeah,
so
and how long has family planning been around in the country?
Oh, it's going on, it's 70-something years now that we've been in existence. Our last milestone event we had was for 60 years, and I think we're due to have 75th or even later as soon. But we can't do those things if we don't have funds.
Yeah.
So, but we're the longest surviving NGO in the country.
Okay.
And we are proud to say so.
Okay.
And we have continued our links with the International Planned Parenthood Federation. And so we can continue to espouse and to assist with sexual rights and reproductive health. And I forgot to tell you earlier, I had done a diploma on that at Johns Hopkins, which is one of the reasons why Dr. Jean Wong allowed me to join, because I had that background.
Right. Okay. Okay.
Yeah.
Now, in terms of family planning, what is the organization geared at? I mean, I know, but for viewers out there, who may not know.
Our objectives, I've actually spoken to some of the objectives already, to have people we want to increase access to persons to have quality sexual and reproductive health services at their disposal. We also want to strengthen our educational pillars so that people will not only hear about it or know about it, but they would understand why it is important. And we want to get that, and that's why we're starting this series of discussions and workshops and stuff. And this is why we're going to be we already have in-clinic videos, but as we do more things, we will continue to do that kind of thing. We also want to, anything that you do, you want to look at the outcomes. We would like to improve and advance the health outcomes of the nation, not only now, but for generations. And because we've been around for so long already, I think we have a good track record to stand upon.
Years.
Yeah, that's a long time. And really expand the reach of family plan, because we do have mobile clinics. We went through a period where we had no mobile clinic, but thanks to the generosity.
So that would have been my next question in terms of the outreach and, apart from the actual clinics in San Fernando and Port of Spain, what do you all do?
We do outreach. We go to what they call far-flung places, even though Trinidad is a small island relatively in terms of the world.
I'm from, they say Quito, Talbakit.
Okay, right. And so we do the mobile caravans, as we call them, as well. And we usually, in fact, we even have those in Port of Spain. At lunchtime, people can go and jump in the mobile clinic and do a pap smear and go back to work like nothing happened. And so we would like to establish a schedule of when the caravan will be where, so people can adjust, because sometimes they might not hear about it and then they can't get off work or they have to do something else. So we want to sort of establish a schedule. Okay, well, for a month we'll be in this area, for another month we're in this area. But again, because we like evidence-based services, we're going to be doing surveys in the different areas to find out where and when are the best times and places for us to do this in their community. Okay. So that's why it's important for people to keep listening to us. We do have a youth we do have an outreach committee, and everybody's Instagram, online, whatever. Not me so much, but a lot of people, and we're doing the best we can to get the word out, because it's so important, and we really want to be doing well with this for the benefit of the country.
Why do you believe family planning is the longest standing NGO in the country?
I hadn't thought about that, but I mean, if I say off the cuff, I said because we care, because we genuinely have the passion, because you really have to have passion. As I said, our staff in the clinics, they are priceless. Mm-hmm. Obviously, it's not going to be a lot of money that they will receive for their services. And the fact that they're so passionate and so willing to help and so willing to work, whatever venture we do, we had a carnival FPATT a couple of times, and they were helpful to raise money to help for various things. Mm-hmm. During COVID, we had to mobilize and pivot and do all kinds of different things differently. And they were up to, we had Zoom meetings, we had all kinds of stuff. And, excuse me, asthma. I think sometimes, I don't like to take people for granted at all, but I think sometimes people can feel that perhaps they're not as valued as they are. Mm-hmm. But with us, they're valued. We can't say, here, take this will give you extra funds, because we don't have it, because we're an NGO. But the passion, the dedication of our staff in the clinics who come every day, 7 o'clock we open, so you know what time they have to leave home. We finish at 3 o'clock, you know, there's a lot of traffic at that time, but they do it every day.
Commitment.
And I would like, on behalf of the Family Planning Association, I haven't asked to say this, but I'm sure the executive director and president and everybody would agree with me when I say thank you so much to all our staff for all that you do every day.
Yeah. And, you know, in thanking them, let's remind the public about the services that can be received at the clinics, especially Perimenopause Clinic.
Okay.
We just have a couple minutes left, so let's remind
do it quickly.
Viewers.
In order to do anything, you have to be screened. So we like to do diagnostic screening. We like to think about things that may prevent things from happening, prevent bad things from happening, and we like to make sure that we diagnose correctly. Mm-hmm. So in order to do that, we have to get a history, get information, and then when we come to the point where we need the test, we need to do pap smears to make sure that, because cancer of the cervix is the leading cause of death in the Caribbean. We do ultrasounds, because ultrasounds are like an imaging. So you look inside, and but you look inside the body and see whether the uterus is okay, whether the ovaries are okay. So we offer that. We do offer ECGs as well, because women in particular can have atypical heart attacks where the heart attack will be recorded on the ECG, but they wouldn't feel the typical pain in the chest and going down their arm. They might just feel nauseous or unwell. So we have that possibility as well. We can refer for blood testing, and of course we have the consultation for the Perimenopause Clinic specifically. But if they're there for just a pap smear, then they can be counseled on other things. If there's anything else, they can just bring it up. Yes. I think I answered the question there.
Yes, yeah? And good. Remind me of the numbers for both clinics. Let
me see if I can remember offhand again, because I don't usually call it. 623-5169. Got that right, yes. And 652-3065. Port of Spain, on the corner of Charlotte and Oxford Street. It's a blue building at a traffic light. Yeah. I think it's the second traffic light coming down from the hospital. And the other one is 50 Bertrand Street in San Fernando. And that's a cute little building too. I think it's blue and white, that one. So those are the numbers. And times of opening and operation would be Monday to Friday, 7 o'clock in the morning until 3 o'clock in the afternoon. So we try to cater for morning workers, afternoon workers, people who are at home looking after children, and so on and so forth.
Yes, and perimenopause would be on Wednesdays.
Perimenopause Clinic at this time is only on a Wednesday in Port of Spain from 9 o'clock in the morning until 1 o'clock in the afternoon. And we don't see more than 6 patients at a time, because we need to have some quality time, and our obstetrician gynecologist is there to give the best advice possible. And they can book in advance for when they would like to come, and we will be happy to accommodate.
Oh, thank you so much for coming on to Breaking Stereotypes. Pleasure. And sharing this, new chapter with family planning, and also sharing about what's been happening for the past 77 years.
Yes. We're we've been blessed. I mean, we could do with a few more blessings, but we've been blessed, and we want to continue.
I'm sure it's coming your way.
Hope so. take that. I'll take that.
Yeah.
On behalf of the Family Planning Association, I'll
I'm
take
sure
that.
it's coming your way because, you know, perimenopause and menopause, it's such a big thing. We have an aging population. More and more women are coming out and speaking about something that they
This
have been
phenomenon.
experiencing, and something that traditionally was kept a secret.
Yeah. And the good thing is, too, that because it's an emergent specialist area by itself, a lot of people who have the funds can go privately and do it.
Yeah.
So we are trying now to get that expertise from those specialists aligned and affiliated with Family Planning Association as well.
And it's quite needed.
And we're definitely going to have a session for distribution in terms of, because I've already contacted the one of the specialists in the field.
Okay.
So look forward to that.
Again, Dr. Davis, thank you so much for coming on and sharing so much with us.
Thank you so much. On behalf of FPATT, thank you to you for hosting this interview.
You're welcome.
Good.
That's it for Breaking Stereotypes. I'm your host, Kristy Ramnarine.